What's That Ringing in My Ears by Mary Copeland. I have a white noise in my ears at times. What is that? Can I make it stop or will I always live with this? Does it mean I have a hearing problem or will I develop one? Great questions. It sounds like you may be experiencing tinnitus. Sufferers often describe it as a ringing, buzzing, hissing, or whooshing sound in the ears. Tinnitus can indeed be bothersome, but it's not usually a sign of a serious underlying condition. However, it can be a symptom of an underlying problem such as hearing loss, exposure to loud sounds, earwax buildup, or certain medical conditions. Whether you can make it stop or not depends on the underlying cause. In some cases, addressing the underlying issue, such as removing excess earwax or treating an ear infection, can alleviate tinnitus. However, in many cases, tinnitus is chronic and may not have a cure. But there are management strategies that can help reduce its impact on your life, such as sound therapy, cognitive behavioral therapy, relaxation techniques, and avoiding loud noises. Dr. Rachel Cook, audiologist at Applied Hearing Solutions in Phoenix, Arizona, talks about 5 of the top ways you might be making your tinnitus worse, and she offers solutions on how to make improvements. Number 1, caffeine and nicotine consumption. Both caffeine and nicotine are psychomotor stimulants, meaning that they really supply that get up and go feeling for many people. One risk of these stimulants is increased blood pressure, which often results in an increase in tinnitus perception. This is because the function of the cochlea, your hearing organ, depends heavily on the oxygen it gets from the consistent blood flow. Higher blood pressure can restrict the opening of blood vessels supplying the cochlea, limiting blood flow and oxygen and increasing tinnitus perception. If your tinnitus seems to spike at certain times of the day, you'll want to take note of how much caffeine or nicotine you've already had and adjust your intake accordingly. Number 2, taking common medications. Pain relievers like aspirin, ibuprofen, and naproxen, high-dose antibiotics, loop diuretics, and antidepressants can all increase tinnitus perception. They can become more permanent with higher or more long-term dosages. If your tinnitus seems to increase while taking any of these medications, be sure to talk to your doctor and your pharmacist to see if any alternatives exist for your situation. Number 3, alcohol and salt consumption. Alcohol and salt both change the concentration of fluids within the cochlea that need to remain in the right balance to function correctly. Alcohol concentration change can certainly change the behavior of your tinnitus, often resulting in an increase in tinnitus perception while the alcohol remains in your system. Alcohol also changes blood flow patterns and neurotransmitter production in the brain that both impact tinnitus perception. And for many people, high levels of salt can also replicate these effects on tinnitus, seeming to increase after high salty snacks or meals. If a drink or a salty snack often work is part of your evening routine, make sure to pay attention to the impact that this has on your tinnitus. You can adjust your routine to reduce or remove this habit, or at least benefit from the knowledge that drinking or eating high salt foods will very likely cause an increase in your tinnitus. Oftentimes, just knowing to expect an increase in your tinnitus is enough to remove the negative emotions around a tinnitus spike. Number 4, poor sleep. I know it's a vicious cycle when poor sleep contributes to tinnitus perception because oftentimes it's tinnitus is what makes it more difficult to fall or stay asleep. However, poor quality or inconsistent sleep can increase your stress levels, making it harder for the brain to ignore tinnitus signals. It's no surprise then that your tinnitus may sound louder after a night of poor or very brief sleep. This is especially true with sleep disorders like sleep apnea and insomnia. Be sure to talk to your doctor about any conditions that you find are impacting your sleep. View my video on sound therapy strategies that can make it easier to fall asleep and stay asleep. 338, How to Eliminate Your Tinnitus Using Sound Therapy on YouTube. If your tinnitus is stopping you from falling or staying asleep, then you must absolutely see an audiologist that specializes in tinnitus to evaluate your symptoms and discuss management so you can get a good night of rest. Number 5, untreated hearing loss. Nearly 90% of individuals with tinnitus have some level of hearing loss. And if that hearing loss worsens over time, so too can the tinnitus. 70% of people with tinnitus and hearing loss who treated their hearing loss using hearing aids alone saw a significant reduction in their tinnitus. This is likely because returning missing sound information to the brain helps to reduce internal signals trying to make up the difference, especially when combined with counseling and sound therapy. Strategies like tinnitus retraining therapy or progressive tinnitus management can result in considerable reduction in tinnitus perception. Overall, tinnitus is sensitive to many things. Knowing more about your triggers can help you to prepare for expected tinnitus changes and remain in control of your feelings towards it. Managing your tinnitus is totally possible once you begin determining which habits make your tinnitus better or worse, says Dr. Rachel Cook. While I was on YouTube, I came across this video by Dr. Rowe, R-O-W-E, at St. Joseph, Michigan, St. Joseph, Michigan chiropractor. He shows an easy exercise that can give instant tinnitus relief, even within 30 seconds. This exercise can be done at home, requires no equipment, and can be done throughout the day. Here's the link showing how it works. Go to YouTube and pull up one move for instant tinnitus relief. #shorts. And yes, I did try the exercise and will continue with it. Remember, experiencing tinnitus doesn't necessarily mean you have a hearing problem, although it can be associated with hearing loss. It's always a good idea to have your hearing evaluated by a healthcare professional if you're experiencing tinnitus or any changes in your hearing. They can help determine the underlying cause and recommend appropriate treatment or management strategies.